Okay, hi everyone. We're really excited to share this little presentation we've put together for you. I'm just going to start by talking about ourselves. So we are dental hygiene students from Southern Ontario Dental College, and our goal today is to educate you on the oral health of elderly at your long-term care facility. So I'm going to start by introducing our little team. My name is Rubani.
My name is Natalia.
Sarah.
My name is Gina.
And I'm Noah.
Okay, so let's get started. Now, as we know, the most important aspect of elderly care is improving their quality of life. Their oral health plays a huge part in that. There are several signs of dental problems that you can probably recognize when you're working with the elderly. These include red or bleeding gums, which points to gingivitis, bad breath, loose, broken, or discolored teeth, ill-fitting, broken, or chipped dentures, mouth pain or sores, that do not heal, difficulty eating, as well as changes in behavior. So the reason that oral health is so important in seniors is because it plays a huge role, as I said, in maintaining their quality of life. It affects the way they consume food, what kinds of food they consume, as well as the nutrition that they're taking in. And it's as we see, a lot of elderly people wear either full or partial dentures, and it's so really important that we keep their oral environment as healthy as possible and that they get their regular checkups to prevent any oral and systemic health problems. Seniors are also known to be at risk for root caries, denture stomatitis, dry mouth, periodontal disease, and exposed roots, and we're going to be covering these in depth. So to begin with, I'm going to talk a little bit about gingivitis and how you can identify it. So gingivitis is a reversible oral condition, and as you can see on the far left of the screen, you see really healthy gum tissue. It's like a pale pink color, and the tissues don't look inflamed. And then mild and moderate gingivitis, you'll see a little bit more of that inflammation and redness that you don't see in the healthy gingiva. And then when you move on to severe periodontitis, you can really see the gums starting to swell up, and they're covering, part of the tooth. The bacteria that's stored within the gingival tissue. So gingivitis, if left untreated, can go on to become periodontitis, which is an irreversible condition. So all the soft, like plaque that you see starting to accumulate on teeth, over time, it usually hardens and becomes calculus. And because of this, it starts to eat the gum and the bone underneath, which then leads to mobility issues and tooth loss.
So root caries, also known as cavities, are caused by a combination of factors, including bacteria in your mouth, frequent snacking, sipping sugary drinks, and not proper cleaning. Essentially, over time, plaque and bacteria mixed with sugar and teeth lead to tooth decay. So people that are at risk are exposed roots, poor oral hygiene, sugary diets, xerostomia, also known as dry mouth. These are all areas where you're susceptible to root caries. So denture stomatitis is a condition where mild inflammation and redness of the oral mucosa membrane occurs beneath a denture. It appears red, swollen, and sometimes red dots. It is due to ill-fitting dentures and poor oral hygiene. So there are many treatments available. Most of them involve sucking tablets or lozenges slowly in your mouth. Antifungal cream is also an option. So you would want to go to get a microbial swab for the palatal, and for the denture surface, we'll confirm the fungus.
So xerostomia is another condition you see in the elderly, and it can be caused by a multitude of factors, such as the medications that they are on, the medical condition, as well as any radiation that they have received for the head and neck region. Now, dry mouth is a really big problem in the elderly because it leads to an increased risk of developing dental caries, periodontal disease, gingivitis, as well as mobility and tooth loss. There are treatment options that the elderly can use. Sugar-free gum is one, as well as candies. They can sip on water or suck on chips so that it increases the salivary flow. They can also use water-based lip lubricants, as well as moisturize their mouth with artificial saliva sprays and gels. Xylitol, which is like a sugar-free gum, is a really great option to recommend to them.
So the benefits of maintaining oral health include prevention of tooth decay, prevention of gum disease like gingivitis and periodontitis, which can lead to tooth loss, prevention of bad breath and dry mouth, improvement in overall confidence, maintenance of healthy gums, prevention of staining of teeth, and improvement of overall health. Good daily oral hygiene includes flossing at least once a day, brushing at least twice a day, using a fluoride daily in your toothpaste and mouth rinse, using antimicrobial mouth rinse daily, replace your toothbrush every 3 months unless you become sick or if the toothbrush begins to fray, and schedule regular dental checkups. So, toothbrushing considerations. It is important to note that brushing someone else's teeth is not the same as brushing your own teeth. When brushing your own teeth, you are getting feedback from within your own mouth, which lets you know how clean your mouth feels or if there are any tender or painful areas. It is also important to note that the mouth can never actually be sterile, but elimination of bacteria to your best abilities is key. Be aware of any feedback, verbal or nonverbal, from the resident that you are receiving. So, not all toothbrushes are appropriate for everyone. Residents should have a toothbrush for their teeth and a different toothbrush or denture-specific toothbrush for their dentures. Toothbrushes should be replaced at least every 3 months or immediately after an illness. Soft or ultra-soft toothbrushes are best to minimize damage to the gums. Toothpaste should be abrasive but not gritty in order to remove the plaque. Do not use toothpaste on dentures as it can be too abrasive and damage the dentures. Choose a toothpaste with a fluoride in it and use only a pea-sized amount. Mouth rinse is a good addition to maintain a healthy mouth. However, it does not replace brushing and flossing. If there is dry mouth present, use an alcohol-free mouthwash with fluoride. There are many types of mouthwashes available on the market, including some for dry mouth. Use a small amount in the mouth and force the liquid between the teeth, swishing for 30 to 60 seconds. Spit it out and do not rinse. Do not use if the resident is unable to spit, and read the instructions for correct frequency. Residents should be seated during oral care. To minimize stress and strain on the neck, stand slightly behind the resident. Standing allows better access to the mouth. If the resident is in bed, sit or stand beside their head. Stabilize your thumb by gently resting it on the resident's chin. For people with dementia, position yourself in front of the resident. In this case, standing beside or behind may discourage their participation and make them feel more anxious.
Brushing techniques. Brush your teeth for 2 or 3 times at least a day. Avoid hard scrubbing. Hold the brush at a 45-degree angle and gently brush in short strokes from where the tooth and gum meet to the top of the tooth. Brush all outside and inside surfaces and pits, crevices of the chewing surface with short chewing strokes. Brush tongue to remove bacteria and get a fresh breath. Flossing technique. You need to use a good position when flossing. Pinch floss between your thumb and index finger. Glide floss between the teeth and slide under gums using a C shape around each tooth. Pull out and move to the next to the tooth using a clean section of floss. Gums may be bleed during flossing, especially if gingivitis is present. This is normal and usually stops as gum become healthier. Interdental aids. There are a variety of floss and floss aids available commercially. Interdental brush have a handle which helps to access the back to the teeth. Interdental brush can be used with mouthwash or toothpaste. Handle should be rinsed after use. Tips and brushes should be replaced when worn. Toothpicks fit in a space between teeth to gently massage gums and remove debris. This must be used with care to avoid damage to the gums. Floss handles shows in the picture are helpful so that care providers can avoid putting their fingers in the resident mouth when flossing.
What is plaque and calculus? Plaque is a soft, sticky film that builds up on the teeth and contains millions of bacteria. It can cause tooth decay or gum disease if not removed regularly through brushing and flossing. Calculus is also called tartar and is a form of hardened dental plaque. It can only be removed at the dentist, and a high saliva flow can be a contributing factor. Importance of identifying oral lesions. Most oral cancers are caused by potentially malignant lesions. Detailed clinical examinations are crucial in prevention. Early detection of these lesions through regular dental visits can help determine treatment options before the situation becomes life-threatening. The 8-step monthly oral cancer screening is beneficial to every client. These are some pictures of oral lesions that can occur. Denture care. After eating, you should remove your dentures and clean your mouth and tongue. Brush your dentures at least twice a day with a soft bristle brush and a non-abrasive denture cleaner. Soak them overnight in a denture cleaner and rinse them thoroughly before you put them back in your mouth. Schedule regular dental checkups and let your dentist know if the fit is not right.
So now I'm just going to talk a little bit about customizing oral care for the elderly. Now they might have a certain dexterity issues or their range of motion might be limited. So we can definitely adapt these, oral self-care tools for them. So we can definitely use something that will help strengthen their grip and as well as add length to their reach within the mouth. And clients with poor dexterity can definitely benefit from using like a power toothbrush, which has a larger handle, so it's easier to hold. They can also use a universal cuff for assistance if that helps them hold the appliance better. And they can surround the surround toothbrush, is also to clean all surfaces of the teeth, while it's also beneficial at the same time for people who have dexterity problems. I'm just going to end off by talking a little bit about how oral health affects systemic health, and this will kind of give you an overall picture as to why it's so important for them to, for us to help them in maintaining their oral health. So lots of studies have shown that gum disease is linked to Alzheimer's, dementia, as well as early onset of diabetes. It also contributes to aspiration pneumonia, as well as endocarditis and other cardiovascular diseases. So overall, it's just extremely important that we help maintaining our oral environment and keep it healthy and This is a little post-test survey that my team and I created, and it's basically, getting an idea of what you learned from the presentation and whether the information we covered was sufficient enough. So if you can complete that and email it to us, that would be really great, because it would be really good feedback for us to, kind of know what you learned and what you got out of this presentation.